Good afternoon, ladies and gentlemen. I will be leading the press conference this afternoon. We will start with an update from the Minister of Health, and I will discuss how landlords and tenants can give help to each other during this difficult financial period, and I will also present an overview of a brand new price gouging tool of which we have put in place. And then the Minister of National Security will give an update on today's EMO meeting. Minister of Health.
Good evening, everyone. I would first like to begin by offering again my sincerest condolences to the families of the two individuals who tragically became Bermuda's first COVID-19 fatalities earlier this week. All of us at the Ministry of Health were truly affected by the news and can't imagine the grief that you must be feeling. It is in this context, it is especially relieving to be able to report that although today there were no additional test results, the good news is that the number of recovered individuals is now at 21. As of today, the number of confirmed positive cases in Bermuda remains at 39, with 6 hospitalized and 10 active cases under public health monitoring. The average age of the confirmed positive cases is 47 years old, with the median age also at 47, and the age range between 18 and 83 years of age. The average age of those hospitalized is 71 years old, and of the 39 cases, 23 are males and 16 are females. Overall, of the 306 tests that have been conducted, 39 were positive, with 241 were negative, and 26 are pending results, which will be received shortly. As of today, there are 123 persons in quarantine at the government facility and 58 persons who are under self-quarantine with public health supervision. I think by now pretty much all of us appreciate the threat, the real threat there is of COVID-19, and we must take this threat very seriously. This is why Bermuda is testing as much as it can and ramping up our testing more widely so that we can detect cases earlier, isolate them, and then follow up with the close contacts as quickly as possible. Our testing criteria has changed, and it is far more wide-reaching. The WHO the WHO guidance, which we follow, has relaxed slightly so that the case definition no longer specifies the travel aspects for individuals who are suspect for COVID-19. And also, we are now testing persons with respiratory symptoms of any kind. However, it is important to note that in order to be tested, an individual must first be assessed by their physician, who will then refer the patients for testing via the epidemiology and surveillance unit. We have received queries from the public over recent days asking if government plans to source any rapid tests. And to that, I have to say that we are exploring all avenues when it comes to the procurement of valid testing kits from all over the world. However, it should be noted that the test results that we have in Bermuda with the real-time PCR can be obtained and available between 24 and 48 hours. And this turnaround time depends, among other factors, and one of the factors is as it relates to the number of tests that are being given at that particular time. The lab tries wherever possible to do batch testing so that our testing materials can process more tests at a time. By batching, it allows the best use of testing capacity, and it is for this reason why some results come through after 48 hours rather than 24 hours. What I can assure completely is that we are testing all symptomatic persons and conducting contact tracing fully to ensure we leave no stones unturned in identifying and isolating any suspect cases immediately. This stops the spread in its tracks. Another question the ministry has been asked is how much do testing kits cost, and will under or uninsured persons have to pay for them? And as the Premier has already previously stated, the cost of test kits will be covered. Nobody will be asked to pay out of pocket for clinically referred testing. The cost itself varies depending on the type of test performed and if the batch testing is done. It is not possible to provide a set figure at this time, as there are many other factors involved. However, we can say that it has been agreed that $300 will be covered by those that are insured. In closing, I would again like to thank the staff for the tremendous effort and hard work they are putting into fighting this virus. It It is easy to remember the frontline workers we traditionally think of, the doctors and the nurses, et cetera, but there are many, many people involved behind the scenes, involved in combating and mitigating against COVID-19. The staff of the COVID helpline receive over 200 calls a day over a course of 12 hours, and they do a stellar job at providing information and reassurance to the public. The epidemiology team works long hours translating the testing and contact tracing data into the numbers that we are able to share with you on a daily basis. And testing itself is a massive coordinated effort involving long hours, exposing oneself to potential risk as well. And there are many, many other members of the staff, from administrators to accounts persons to communicators, who are all developing guidance documents, keeping the website up to date, and paying the bills for the materials being purchased. COVID containment is a tremendous public health effort, and I'm grateful to my team at the Ministry of Health, whose work is often invisible, but has to be applauded for helping to keep Bermuda safe and well. Thank you.
Thank you, Minister. The reality is that Bermuda, and indeed the whole world, is experiencing an unprecedented event at this time. This means we are facing a situation that has never, ever been encountered. Therefore, it requires new solutions, solutions that aren't necessarily ideal, but we must also at this time show compassion towards each other. With Bermuda currently under a state of emergency, any landlord-tenant dispute will not be processed in the judicial system at this time. I want to make that clear. Any emerging landlord-tenant disputes will not be processed in the judicial system at this time. Therefore, I am encouraging landlords to assist tenants experiencing the financial hardship as a result of the COVID-19 global pandemic. And I'm asking landlords to consider realistically assessing their own financial situation and obligations as to how they can assist their tenant. Talk to your tenant and assess each tenant's situation on a case-by-case basis. Take into account the current ability of your tenant to pay and the history of that tenant's record as a tenant in that tenancy. Landlords are also asked to have compassion for tenants who may not have any family in Bermuda and who are not eligible for the financial assistance program, but may be eligible for the unemployment benefit program, which has been put in place. However, it should be noted and it should be understood that tenants who do have the ability to pay their rent should do so in accordance with whatever agreement they have as part of their tenancy. Any changes to any lease must be documented and acknowledged by both parties involved on agreement reached, including whether any reduction of rent is temporary or if the rent reduction is to be deterred for a later time when that tenant has a greater ability to pay. In addition, any agreement reached to amend payment terms should be reviewed on a monthly basis and be up to 90 days in length. Working in collaboration with the Real Estate Division of the Bermuda Chamber of Commerce, COVID-19 landlord and tenant addendum agreement guidelines have been put in place, as well as a COVID-19 rental relief form. And they have been developed to support any discussions around adjustment of rent payment during these uncertain times. And that form can be found on www.coronavirus.gov.bm. As we adapt to the effects that COVID-19 is bringing to Bermuda, we have to be mindful of the economic factors which impact the ability of our residents to navigate the uncertainties of these times. The cost of goods is a major concern for everyone in Bermuda. In response to the numerous emails and phone calls that have been received relating to price irregularities in Bermuda and in the Bermuda marketplace, I am very pleased to announce that the Ministry of Home Affairs, in conjunction with the Cost of Living Commission, have developed an online reporting tool with the support of the Cost of Living Commission Chair, the Honorable Derek Burgess. This online tool will allow residents to submit any information that they have on any allegations of possible price gouging in Bermuda. Now, let me just give a definition of what price gouging is defined as. Quote, a seller increasing the prices of goods, services, or commodities to a level much higher than is considered reasonable or fair and is considered exploitative, potentially to an unethical extent. Usually this event occurs after a demand or supply shock. Common examples include price increases of certain basic necessities after a hurricane, other natural disaster, and of course, what we're facing now, a pandemic. This easy-to-complete form, which is online, will be anonymous and will be used to inform the chairman of the Cost of Living Commission of any price irregularities that may be going on in Bermuda. For further investigation, and the chairman will use this under his authority, and he will be able to effectively investigate any potential instances of where price irregularity exists. But it must be also understood that it is not the Commission's remit to issue refunds. Rather, it is for business practices to be regulated so that the consumer is protected from any existence or unethical pricing methods that may be in place. If one wishes to report any price irregularities for review by the Cost of Living Commission, they may go to the following website, forms.gov.bm/COVID-19/report-a-price. I now will ask Minister Keynes to give the update from today's email meeting. Minister Keynes.
Thank you, Deputy Premier. Viable leadership was provided by all officers involved in the shelter-in-place operation during the last 4 days. The joint operation includes a complement of officers from the Bermuda Police Service, the Royal Bermuda Regiment, and they are working together to ensure the public's compliance. I should note that a number of individuals have been stopped by the joint operation officers over the 4-day period. Individuals with a legitimate reason or exemption to be on the roads were allowed to pass through the stop points. However, there continue to be many individuals who have no valid reason for being on the road. Those individuals are turned back. Again, I am urging members of the community to please adhere to the guidelines set out in the Emergency Powers Act 2020. A decision has been made to increase the various community checkpoints around the island. Today, we doubled from yesterday, and we had 160 officers from the Bermuda Regiment and officers from the Bermuda Police Service. Over the next day or so, there will be more checkpoints and higher visibility of the Bermuda Police Service and the Royal Bermuda Regiment in the east, west, and central parishes. It should be noted that members of the Bermuda Police Service has the authority to arrest and detain any individual who is not adhering to the guidelines set out under the law. I will now provide a general update regarding the returning residents on the special flight today. Today, we welcome home 70 returning residents on 2 flights. The disembarking process was efficient, and these residents will now spend 14 days in the government monitoring and approved quarantine locations. I wish to thank the members of the Disaster, Risk, Reduction and Mitigation Team, the Immigration and Customs officers, and the Royal Bermuda Regiment for their assistance in helping our returning residents transition back home. Lastly, I think it beneficial to provide a reminder why we have instituted the Emergency Powers COVID-19 Shelter-in-Place Regulations 2020. For the avoidance of doubt, our objective is to limit the movement of the general public to prevent the widespread and transition of the COVID-19 virus in Bermuda. Again, I don't know how many times we need to say it. We are urging members of the public to please adhere to the guidelines. Please only leave your house for essential matters. If you do not need to go out on the roads or out and about, stay at home. Stay inside. Shelter in place may be inconvenient for you in the short term, but it will benefit all of us in the long term. At the end of the day, we are doing this to save lives. Thank you.
Thank you, Minister Keynes. In closing, I would like to echo the statement of everyone at this table and made today by the Minister of Health, the condolences to the families who have lost loved ones as a result of this virus. That was obviously a blow for everyone in the island yesterday.
Yes.
The Premier certainly reflected the feelings that we as a government, and I'm sure the public had as a result of hearing that yesterday. But it needs to be emphasized that this virus can kill. And unfortunately, we have 2 families in Bermuda who have now experienced that pain that we've seen over hundreds of thousands of people around the world have experienced. So that should crystallize to every person in this country what the stakes are. And they should not forget it. I'd like to further say, it is also important that people understand that what is being done is to reduce the spread of the virus. And we all have a role to play in this important process. As the Minister of National Security and the Minister of Health and the Premier has said repeatedly, if you don't have to go out for essential groceries or medication, stay at home. Shelter in place is the order of the day, and a measure that started this past Saturday and must be maintained to protect everyone in this country. If you do have to go out for grocery or gas or the pharmacy, wear a homemade mask. There are many videos online providing details for making a mask. And you can also go to our own government website, coronavirus.gov.bm, for instructions how to make your own mask if you need to. In addition, I would like to, as has been echoed by everyone at this table, thank all the persons who have been on the front line for many, many weeks with fighting this virus. Our healthcare workers, people who are providing services to the most vulnerable, people who are providing the grocery assistance at the grocery stores and delivering groceries to those who cannot get access to food, those who have been organized to support people who don't have homes, the other people in the medical community who are doing other services, and even people who are just doing little things to help some of our citizens get through this period. I'd like to echo a thank you to them once again. It is echoed every day, and it means the same every day. They are helping us to get through this, and we must always remember them as we do these presentations and as we get out in our community. But I would also like to add another note of thanks and express the Bermuda government's sincere thanks to the principals of Well Bottom Plumbing Supplies Limited and Burroughs Plumbing Services for the generosity of donating 2,000 surgical masks and another 1,000 disposable folding masks. The surgical masks will be added to the Ministry of Health's inventory, and the folding masks will be provided to our sanitation workers who are out there collecting up the waste around the island on the regular schedule, which continues to operate. We need to provide protections for everybody who's out there on the front line trying to make sure this country stays together. So thank you to those who are donating in these ways, and there are many others I'm sure that we will mention over the time that have already been mentioned, who are actually doing a lot of work behind the scenes, as the Minister of Health has mentioned, to provide resources so that we can get through this. So thank you to Well Bottom Plumbing and Burroughs Plumbing Services and all the other entities that are actually offering and giving support to get us all through this. Thank you, And we'll now accept questions. The Minister of Health will accept all questions related to the COVID-19 activities and any health-related matters, and the Minister of National Security will answer any questions towards shelter in place and the state of emergency and the EMO.
Good afternoon, Deputy Premier. Good afternoon, Ministers. To start off with, we've had a lot of conversation about masks.
Can't hear you.
Pardon?
Can't hear you.
Yeah,
Oh, very sorry. We've heard a lot of discussion about masks recently. Government, of course, has changed its policy to encourage use of masks in public place. I'm wondering where that comes from. The Center for Disease Control and the World Health Organization have disputing ideas about this.
Okay, thank you for that question. You're absolutely right. The World Health Organization and the CDC seem to have been at odds with respect to this. However, the government made the decision based on consultation with the Chief Medical Officer to encourage persons to wear a mask, because persons that may be asymptomatic may actually be carriers but not having symptoms, so the protection of the wearing of the mask is for other individuals. We've also heard that the Chief Medical Officer has indicated that it's a mask for a person that it doesn't prevent you from getting COVID, but it's more of a protection for other persons where an asymptomatic carrier may very well be carrying the virus. So we are following what the CDC is recommending. However, there's two things that I need to add to that. One is that there are certain types of masks that we are discouraging persons from using, such as the ones that are meant for medical supply or medical use. However, we've got cotton masks that you've heard Minister Birch and the Premier spoke about previously that are being widely distributed within the community, as well as some of the masks that I see here today. So the recommendation is that all persons that are going into public places that are the, as per the legislation, is for them to wear a mask. That is being encouraged. And also, we've also issued guidelines to those individual places, in particular grocery stores and the like. If they are open, then they should make sure that their employees are also properly wearing masks to protect the members of the public as well.
Now, I understand Dr. Karika Weldon has returned to the island. Can you tell us if she has joined the team to help out from quarantine?
Absolutely. In fact, just I'm a few minutes late getting here because we had a very detailed conference call this afternoon with members from BHB, myself and the Premier, as well as persons from the Ministry of Health Laboratory, private laboratories, Dr. Weldon, as you've indicated, as well as Dr. Spriggs, who runs the Helix Lab, for several hours actually, so that we can meet the objective of the Premier, which is to increase our testing capacity. So we had a very detailed conversation. She was intimately involved in that meeting, notwithstanding that she's in quarantine. So we were able to work, fortunately, via telephone, and any of the requirements that she has with respect to getting her lab up and running, we're able to do that virtually remotely.
Question for Minister Keynes. You said yesterday that you were going to be approaching the governor about increasing the number of regiment soldiers who are embodied. Can you tell us how that conversation went?
As always, we had a very good conversation. He is talking with the colonel, and they're looking at what the resources are. Obviously, we have to, as we increase the numbers, we have to look at housing them. As you can imagine, at the Bermuda Regiment, using social distancing, we have to now look at, can we house 250 men in the Bermuda Regiment and women in the Bermuda Regiment. And so there will be an increase. We'll get the exact numbers tomorrow. But what I can say, we had just over 100 men and women on the streets yesterday. Today we had 160. The checkpoints were increased. And so the net effect was that people on the roads today would have seen a greater and a stronger and a more robust presence on the road from our uniformed services.
Now, my colleague Duncan Hall may have some questions. He is working remotely, so hopefully this works. Duncan, go ahead. Give me a quick second. Get you louder. I'm trying. It's on speaker. Can you try that again, Duncan?
Thank you. Mr. Deputy Premier, this is Duncan Hall, a business reporter at the Royal Gazette. I'd like to ask some questions about the economy, if I could.
That is not really a subject for this actual press conference. We're dealing with the issues around shelter in place, EMO, and with the specific health questions around COVID-19. If you have specific questions around the economy, you can give them to us and we can present them to the Finance Minister to provide answers to you.
I can't hear the answer.
contact the finance minister. Perhaps someone else should go.
Yeah, I couldn't even hear the answer, Owen. Sorry?
Good evening, Deputy Premier. For the two families that lost people yesterday, it surely must have been a devastating time that, that we can only barely fathom. Has somebody from government reached out to them to offer some words of comfort and support to them?
I'll pass that question on to security.
I don't know specifically, but it is normally the plan. Our normal plan is to reach out to the families, and the Bermuda Police Service normally has a family liaison officer. I will confirm, indeed, if that process did take place. But as was highlighted by the Minister of Health and by the Deputy Premier, our hearts are heavy with this. This, as a community, we grieve together. As a part of our standard operating procedures, we reach out to the family. I know that the Premier is going to reach out to the families directly. That is something that we do in the main. And so, as a country, we are grieving together, and it will be our position to contact the families directly.
Thank you. Today we brought back some of our people from overseas. There's several videos circulating on social media where a couple of the people, A, were ungrateful to be put up where they were, B, disclosing where they were located for the quarantine, and 3, one of the people asked people to come up and see him.
Disappointing, but let's not talk about the exception and the disappointment to the rule. The majority of the people that are in the government quarantine facilities have governed themselves with discipline and aplomb and have followed the rules. With reference to the food, we're not going to get everyone's specific fancy, and someone might like cornflakes and the other Fruit Loops, and they might not get their special cereal on every occasion. But this is an opportunity for us to all endeavor to show restraint. We do know that there are people with specific dietary needs. Our team is getting together, and we're working on a plan where a number of parents have reached out formally, and they have said, listen, I have some key things that I would like to give to my child, but we know that they cannot do that because of the quarantine and the shelter in place. So what we're looking at, we'll be able to, tomorrow evening, share with everyone what is the plan, how we're going to allow them to get some key goods to their kids. I do believe that this is a time where this is our new norm, and I think everyone that's in quarantine, as us all, we're learning lessons, and I believe this is an awesome time for our young people in quarantine to learn some self-lessons.
Thank you. The 22 Bermudians that were on the Coral Princess weren't able to leave the U.S. because the CDC rules. What's the progress in bringing these people home at this point?
That is still, I'm watching emails go backwards and forwards from a number of individuals. That still remains a work in progress. It will be counterproductive to just give you a blow-by-blow of what's going on, but I want the families of those people on the ship to know that your government and the people in Bermuda are working desperately and feverishly to get everyone back home safely.
All right, thank you. Health Minister, good evening. What plan is Bermuda following for mitigating this crisis? Are we following mostly Public Health England with a little bit of CDC, some of the WHO, or what specific model are we using?
Okay. Well, the World Health Organization, the CDC, PAHU, as well as Public Health England, are united in this approach insofar as the best mitigants against COVID-19 are quite basic. Utilizing hand sanitizer, proper hand hygiene, utilizing, you've heard me speak about that, coughing in your shoulder, et cetera, et cetera. So the best mitigants are the things that we can do ourselves. So all of those entities that I've just spoken about have all unanimously said the best mitigants against COVID-19 is to deal with certain simple basic things like social distancing, utilizing proper hand washing, et cetera. The main objective of this particular exercise that we have now under the emergency measures that Minister Keynes has spoken about is so that we can encourage social distancing. So it's extremely disheartening, I'm sure people can agree, when you see people that are not exercising social distancing. This is for all of us. This is for our benefit. And one of the top mitigating factors that those entities that you've just spoken about have said, the way to mitigate against COVID-19 and to prevent its spread is to exercise proper social distancing, which is why we had to take the steps that we took as a government just the other day. So we have to encourage people to operate under this shelter-in-place order, because it's only going to get worse if people ignore those particular mitigants that I've spoken about, and we will not see a return to our normal everyday life. We will not see a return to our economy and a return to all the other issues that we know are going to be adversely affected because of this disease. So we have to implore everybody, as a government, as a community, if you're concerned about your own well-being and those of your neighbors and your family, stay home.
If everybody does what they're supposed to be doing and help mitigating this crisis, how much sooner do you can we expect for that to end here in Bermuda at least?
Well, I think the main message is that we need to ensure that we all do our part, because if we don't, then we're not going to see an ending as soon as we would like. All right, we know that COVID-19 is a pandemic, so it is all in every continent in the world. So we recognize that it is, like I said, a pandemic. However, it is important to note that if we mitigate, the best steps to mitigate, and if we utilize those particular efforts, then we will be able to recover from this sooner rather than later. It will be prolonged if people completely ignore the directives of the government as it relates to social distancing.
Is the plan to help prevent people from contracting the virus for an indefinite period?
The plan to mitigate against COVID-19 will be until COVID-19 is gone. So the reality is, again, until we have full participation from members of the public and the community to ensure that we are taking steps to mitigate against the spread of COVID-19. It is here. We know that. You hear us read the data and the statistics every day. But what we need to do is to take steps to try to mitigate it and flatten the curve, so to speak, so we don't see this increased intense surge with respect to large numbers of our population getting COVID-19 and overwhelming our healthcare system. That is one of the principal objectives that we are trying to meet with respect to the shelter-at-home initiatives that have been announced by the government.
All right, thank you.
Can I just add to what the health minister said? I think it's very clear, and if you're paying attention to what's going on globally and how many other agencies like the health minister oversees, how they're determining when we can move to different stages. If we begin to, as has been said from the beginning, can flatten the curve and begin to see perhaps less cases appear, then we can begin to think about what's next for the community. If we can begin to move to another phase of where we can bring more flexibility to the shelter-in-place measures that are in place. But this has not been done to make life any difficult for anybody. It's very clear it's been done to save our lives and to save our community from being afflicted with this virus longer than it has to be. So when will you decide to make changes as you've asked? When we begin to see an improvement based on the advice of the chief medical officer with the consultations that they are relying on, and we'll see an improvement. That's when we'll begin to change the situation, and we can, perhaps the Minister of Now Security can, from his own standpoint, take advice as to changing the shelter-in-place measures. This 2 weeks will be seen as progress if we can determine at some point before it ends that our situation has improved. That's when we will begin to see us making decisions, as tough as they have been, to make changes that will benefit the community.
One last question. Obviously, Boris Johnson, the Prime Minister of the UK, has been hospitalized. I was wondering what measures government ministers are taking to protect themselves.
Government ministers are following the rules, practicing the mitigation measures that the health minister has actually outlined. Also, we're doing our meetings remotely. We're not getting together in the same room. So we are practicing the guidelines, the basic guidelines as the Minister of Health has outlined. We hope that that shows people what can be done as well. But that's what we're doing so that we can stay healthy to continue with the business of the country. I'd like to just say one thing before we close, finally, to thank the sign interpreters who are here. They have been a constant feature of this process here and at the Cabinet Office, and we thank them for, they're also on the front line of being here and helping us to service some part of our community so that they are properly informed on the developments and what's being done to assist them. So thank you to the sign interpreters as well as those of you who are here as journalists as well, helping to inform the community of the developments as they transpire. Thank you.